Thank you very much, and welcome back to This Just In. We're broadcasting live from the HIMSS conference here in sunny Las Vegas. Gorgeous day, actually high of 82. So if I make all my listeners jealous out there, it is just gorgeous here in Vegas, and I always feel at home here. So we're broadcasting live from the Sands Expo and Convention Center. If you're in the area, please stop on by. But very excited about my next guest, Rosemary Ventura, Director of Nursing Informatics for New York Presbyterian.
That's correct.
Fantastic. Welcome to the show.
Thank you.
So I'm excited about all my guests, but I do get a little bit more excited from the provider standpoint that you're actually, you're doing it on the front lines. So I love to have you and people like you in the show. So I'm very excited for our next segment, just because what the show is about for yesterday and today is we're trying to get best practices and actionable intelligence. What can people do next? What are you surviving and thriving with in your community? What are you deploying for strategies? But first, let's start off with what trends do you see in your community, and then we'll talk into how you're addressing it. But first of all, what are the top 3 trends that you see in healthcare, health IT in your community?
Thank you for actually focusing on the clinical folks. I'm excited to hear you say that and actually start out with that, because it's near and dear, obviously, to my heart. And at the center of everything that I do is nursing. So really the trend right now in terms of what we're hoping to accomplish at New York Presbyterian is mobility, efficiency, and ease of clinical workflows. Because what we've sort of seen in the past is that we'll tend to implement systems that kind of make it more clunky or more difficult for our end users. So right now we're working on a couple of things to streamline workflows, meaning we want to use one solution. I heard a lot of buzz around consolidation, moving towards one device, very, very important for us. We're sort of have the nurse right now that has the tool belt. I'm sure you've heard that before, multiple devices. So we've actually partnered with one of our vendors who we do barcode med admin with, and a couple of other key workflows for us.
You can mention that vendor.
So we're partnered with Patient Safe.
Sure.
And what they have allowed us to do is implement a solution for our nurses that sort of brings key workflows together in one place. So our nurses don't have to log into multiple applications, which seems to be a trend as well. Everything's about apps. But what that really means is that I'm working in one place. So I'm doing my medication administration, super important, has to be done using barcoding, the barcode, so we have positive patient identification. We're doing specimen collection as well, using that technology, and even more exciting is we've just implemented communications using the same device. So what's really key about that is that we've been able to partner with our EMR, bring over the care team. So I know exactly what nurse, what physician, what nursing attendant is taking care of this patient. I don't need to go somewhere else to look for that information. I have it all right there on one device. I can text those folks securely using a platform that I know is safe for our nurses to use. And really that's been the driver leading us into 2016. So we've piloted that on a couple of our units very successfully, lots of text messages, giving us good information about what are clinicians talking about. So why are they texting each other? We sort of know, hey, I need something for my patient, can you get that? But it's given us information that we sort of didn't know. So information like that's really around a social circle of being a partner on the unit. Very interesting. I don't think I've seen that anywhere else. So I think we're uncovering things that may lead to future technology development around. But we'll see. 2016 is all about mobility, communication, and efficiency. That's
fantastic. So what are some of the ways that you guys are addressing? Obviously, patient safety is one way that you're doing it. Is there anything from the standpoint of, that assists with usability or workflow redesign or care plan redesign, or how are you doing some of those aspects?
So we have a new leader in our organization, a new CIO, and one of his top messages to us is looking at optimizing a lot of the work that we've done within our EMR. So we're partnering with them right now to look at what is nursing doing. Can we make it easier? Because what's interesting is that we've had that EMR for so many years. We've done CPOE for over a dozen years, and we've sort of made it more complicated than it needed to be. It's almost like we got to go back to basics.
That's a very good best practice right there, because I don't think people realize that how complicated they've made things, and that's a good point.
You got to go back and look at what you've sort of created.
That's right.
Maybe every couple of years, look at those processes to really start to drive efficiency, because you're creating differences and changes in moments of time, and no one takes the time to go back to evaluate if those changes made sense or if they've sort of made things kind of more complicated.
Now that's fantastic. That's almost a best practice in itself that I have not heard this entire time I've been here, and I totally agree with that. To going back, because you don't just take the status quo as the status quo. Go back, and because you're right, things are created on the fly, and then maybe take a step back and look holistically at what you've done.
Correct.
And
we don't take the time, because there's always the new fire that you need to, the new regulatory requirement you're looking at putting in, and at the end of the day, you have a discharge note that's 30 pages long. So we really want to streamline a lot of those processes over this year, taking the opportunity to take a step back, stop making changes that are not really driving towards regulatory or other types of key initiatives. Put those on hold maybe for now. Changes in wording and stuff like that, maybe that can wait. Let's use our resources at this time to focus on those other things.
So at New York Presbyterian, what are some of your key focuses for 2016 and maybe 2017? I know they're sometimes longer than 1 year, but what are some of your key drivers as an organization?
Very importantly, we're looking at our discharge process.
Good,
patient satisfaction. I'm sure that's everywhere.
That's
We really want to go to the next level when it comes to our HCAP scores and things like that. A lot of energy around that, but again, a focus on the patient. Everyone I'm sure is saying that, but sometimes we sort of take a little turn.
They're actually not. You're good.
Taking a little turn, but reevaluating and refocusing the organization on priorities that really are driving towards that goal. So that's definitely something we're looking at. Again, I mentioned this one, but it's very, very key for our senior leadership: communications. I can't explain to you why it's so hard to communicate in an acute care setting. You would think it's easy. I pick up the phone, but sometimes it's really not that difficult. So streamlining those processes. And then we have an exciting initiative that we're sort of kicking off this year in terms of telehealth. We're implementing a new program led by Peter Fleischert. He's our Chief Innovation Officer, to really start utilizing those services, because we have very talented physicians. So they should be able to really extend those talents to folks that need help that may not live in New York City.
Very good point. So looking out over 2016, and I like to throw this curveball. I haven't told anybody about this question yet. But predictions for 2016, 2017. Any bold predictions that you might make, either not for your organization, but for in healthcare, what we might see or what you might see in your region or anything like that?
I think that people will be more accepting, and we're going to see more of the patient's actual input into the medical record, even the acute care side. There's a lot of focus of that with wearables and those sorts of solutions, but the trend is really outpatient, driving it to the primary care physician. That's all great. But where is that in terms of incorporating it at the next level when the patient's actually in our hospital beds? What are they feeling? And I may not be there as the nurse to document that right now. Maybe bringing in those elements of, I as the patient think of this right now, and I want to be able to mark that down in my record that I can share as part of the care team with the providers here.
That's fantastic. Thank you very much for joining us today. Rosemary Ventura from New York Presbyterian, you are a fantastic guest. I'm glad I had the pleasure to meet you. I think Michelle Morris from Dodge Communication brought you, so fantastic. Great work.
Thank you very much for having me.
All right, thank you, Rosemary. Talk to you soon.